and welcome to the Empowering Your Patients series. Today you're going to be meeting myself, Jackie, and Tracy, and we will be talking to you about some tools that we've learned as we have become IPEC certified professional coaches on how you can really empower your patients to take control of their lives again.
Hello, my name is Tracy Whitworth, and just to give you a little bit of background on myself, I've been a nurse for about 15 years now, and my nursing career has spanned over very various fields. It entails everything from correctional nursing, obstetrics, pediatrics, but my true founding or calling, if you will, was exposure to hospice nursing, where I learned to be really true what an autonomous nurse is. And from there, I was exposed to the arena of oncology nursing, which is where I found my heart really lied. And I have been exposed to the arena of survivorship, and through that, the many challenges that our cancer patients face in regards to reintegration back in life. That has posed some challenges for myself as well, where it has caused me to even have some questionable abilities of what I can provide to them. And I was lucky enough to find coaching, and through that program, the IPEC certification, I was able to learn some skills that really helped expand on my knowledge base, helped me feel more confident, and by proxy allowed me to empower my patients to take back control of their life and to move forward.
So I thought it might be helpful to share with you a little bit of my background. I have been a nurse for over 12 years, and in that role of being a nurse, there's lots of different opportunities. So most of my career has been in pediatrics and oncology. I've done neuro, trauma, med-surg. I've been faculty in the academia world, and then most recently I've become a director in the adult oncology world. And this has created probably the biggest challenge of my career, and in that developed a lot of insecurities and uncertainties about how I could be a good leader, how I could still impact patients. And with that insecurity, I realized I was actually holding myself back from building stronger relationships with patients and with my employees. So through the IPEC Certified Professional Coaching Program, I have found that there is so much that we actually have control over in our lives. And it was really empowering for myself and for my team and for our patients to really learn some simple skills that can impact their lives. In the oncology world, one common theme that I really found is that they feel like they've lost control over everything in their lives. And it's so rewarding to feel like you can give a little bit of that back. And through coaching, we have really found that by just asking a few simple questions, you can give them so much back in their lives. So we're really hopeful that in our Empowering Your Patient series, you'll really find some value in the few tools that we're going to share, and that you will start to feel empowered in your own life as well as empowering your patients.
When the term coaching was used in my mind, I wasn't quite sure how to wrap my mind around it, because my mind initially went to a sports coach, an activity, wow, we're going to the ball game, and that sideline coach saying, okay, do this, and winning at all cost, and that was it. And I'm like, well, what the heck does this have to do with helping people and helping myself over obstacles? It was quite a quandary to me. And then we start looking at the word coaching in the workplace. What does that mean? What relates to that? When somebody would come up to me and say, hey, I want to coach you on something in the workplace, I automatically would go on the offensive and say, okay, what did I do wrong? What are you trying to tell me? It has a whole stigma that's wrapped around it, but truly that's not what coaching is. True coaching, in the sense of how it should be, is it's a supportive in nature type of guidance, a scenario, if you will. It is one that is going to help you come up with the resolution through looking at a different lens, looking at a different perspective, trying to take yourself outside of that current situation that you're seeing or that you're feeling, and trying to attack it at a different view, which so often we don't do.
So now that we've shared with you a little bit about what coaching isn't and what coaching is, we wanted to share with you an actual IPEC tool that you could already start using in your own life. One thing that we really realized with patients and with ourselves is that sometimes we might have kind of a fear of committing to a decision. We're not really sure what the result might be, so it can hold us back from actually making that decision. So what we've learned through IPEC is that providing what they call a safety net can be really helpful to anyone in their life, but especially cancer patients. So oftentimes when patients are struggling with a decision, sometimes simply asking them, what is the worst thing that can happen, can really start to get them to already think about all the different options that could be with this decision. In a more positive light, you can also ask them what's the best thing that can happen. That way they can also look on the more positive side and think about, if I commit to this decision, what are all the different possibilities, and kind of get those off my chest and not have them keep holding me back. Simply by going through all of the different options can often diminish that fear and help them come to that decision on their own, which again is really empowering. We all know the answer that we want, but yet we look for others for advice. By using these questions, we allow them to look within themselves and come up with that decision, which usually has a great impact on the outcome. So an example of safety net coaching that actually occurred in my own personal life was having a casual conversation with one of my friends, and she brought up how her daughter had been having some issues lately and was appearing as though she might be getting depressed. And her daughter had been asking about, going to see a psychologist and possibly starting on some, antidepressive medications. And my friend had a lot of concerns about her starting these medications and was really against it. And throughout the conversation was just trying to figure out how I might be able to help her. And I was going through the IPEC coaching program at the time, so I kind of thought about some questions I might be able to help her with, to help her feel a little bit safer about, exploring the different options of this decision. So I asked her, what could be the worst thing that could happen to her daughter if she started on the medications? And so she went into, getting possibly dependent upon them, being really sleepy, just maybe not being herself anymore. And, just was really passionate about her not being on medications. She's a young girl and just did not want that to happen. I now acknowledged and validated what she was experiencing. And then I kind of, asked her, well, what could be the worst thing that could happen if she doesn't go on medications? And yeah, as you can imagine, she immediately got, pretty upset, started crying, and just really evaluated, kind of get her own fears getting in the way of helping her daughter. So I can definitely understand what she was going through with that. And then we kind of looked at, well, what are some positives that could happen with her going on medication? And so she's able to really look at and see that her daughter could be happy again and could be in a more positive light. And so instead of, being stuck in that fear mode, by working through all the different options out loud and letting her get her thoughts out, she was able to see that it was just her own fear getting in the way, that, this could actually be a positive thing for her daughter. So she was, really looking forward to trying to be able to help her daughter better. So by using safety net coaching, creating a really safe environment, acknowledging and validating, everything that she was going through, but allowing her to really explore all the different options of this really difficult decision that she was going through. So hopefully throughout the session, you'll learn how you can start using this to help empower your patients during difficult decisions.
So now we're going to begin a real life type of scenario that you might encounter in your own practice, and how you could use the safety net coaching skill. Hi Jackie, I'm Tracy, and I'll be the nurse working with you today.
Hi.
Hi. And I understand that what we're going to talk about today is some screenings. Mm-hmm. And tell me more about what prescription that you have for that.
Well, I recently had a physical with my doctor, and so we were talking about my family history and a lot of different oncology background that's occurring with my family. So I have thyroid, and my mom and all of my aunts have had thyroid cancer. And then also I actually was given a prescription to get a mammogram too.
Okay. So obviously you have some blood workup that's going to be in line with what needs to happen, and I sense that's really not an issue, but I sensed a little hesitation with the mammogram. So how about you tell me a little bit more about where your concerns lie with that?
Yeah, I'm 35, so it kind of caught me off guard a little bit, but I am a little bit at high risk. So, I have breast cancer on both sides of my family, and I have not had a child yet, so, a little bit higher risk. So, I don't know, just kind of the thought of getting a mammogram already. And, I've heard a lot of, stigma around mammograms too, so I guess just not really like looking forward to that.
That's understandable, especially with all the information out there on the internet. And we know the internet's a great place, but we also know that it can be a scary place. You have to make sure that the information you're getting is from a really reliable source. So I can see where, those concerns might come up. But let me ask you, what would be the worst thing that would happen in having the mammogram done?
I think a little bit is I'm not sure about, the pain that I might go through during it. And then also, like, gosh, I might find out I have cancer. And I don't know that I'm ready for that right now.
Jackie, those are some real valid concerns. And I hear that a lot from, clients that come in and they're hesitant to have some of these screenings because they are concerned. The what ifs.
Yeah.
Okay. So Jackie, tell me what the worst thing that could happen if you don't have a mammogram.
I haven't even really thought about that so much. I've been so focused on, the fear of finding out. I guess from a lot of what I've read, I could still have cancer, but then I wouldn't even know it, which sometimes ignorance is bliss. But with cancer, from what I know, we really should try to catch it sooner. So I guess not doing anything really isn't going to help me either.
So Jackie, then tell me what's the best thing that could happen in this scenario?
So if I were to go ahead and get the mammogram, you mean? Gosh, it could come back and I guess be normal. Exactly. And then I guess I would at least know.
Exactly. So true.
Yeah, then I guess, may have some minimal pain while I'm getting it done, but I could find out that I don't have it, and that could probably relieve a lot of my anxiety and stress surrounding it.
So now talking through that,
yeah,
what are your thoughts now versus what they were before?
Gosh, I kind of have to laugh at myself. I was just so focused on the fear of finding out that I had cancer that I didn't even think about I could find out that I don't have cancer too.
And how awesome is that?
Yeah. So, and either way, it's kind of probably not in the best interest to just ignore it and avoid it.
Exactly, because if we ignore it and avoid it, just like you had mentioned earlier, then we could be looking at a whole different scenario.
Right. No, thank you.
So let's get you in. Let's see how soon we can get that screening done, and then we'll follow up afterwards. How's that sound?
Still a little insecure about it, but definitely much better now. Thank you so much. That helped.
Sounds great. So I'll talk to you after you have that.
Okay. Well, we hope that this series has been insightful for you and that you feel like you've learned a little bit more about coaching and that you'll be able to start incorporating the safety tool. Oftentimes, it's easiest to start with a friend. Tracy and I did that often. We went through the coaching program together. So we would start to practice with each other and try to make it feel more natural so that you're not hesitant when you're talking with your patients. And then start to try it with your patients. You'll be surprised how it'll just start to come really natural. You'll sense something in them and want to start, kind of exploring those options with them. So we hope that you will keep joining us for our future series on how to empower your patients. And we appreciate you being a part of our session today.
Thank you.